Hi, everyone. Gabby here, owner and clinical director of Recovered and Restored Eating Disorder Therapy Center. I hope everyone is doing great. I am jumping on today because my husband, Andrew Barber, agreed to join us. The reason why I'm having him join us is because Andrew was and still is a very great support to me in recovery. And a lot of times I get questions about how to support a partner. So we're going to talk about how to support a loved one. We're going to talk about how to support a partner. And Andrew's going to share a little bit about our personal story and things he did that I found really helpful. And that I think maybe if you are a support person, you might find helpful too. So Andrew, tell us about you. Tell us about your role and all the things.
So I am husband to the director and clinical director of Recovered and Restored Eating Disorder Therapy Center, my wonderful wife.
Yeah,
I am also your unpaid tech intern.
that's not true. But anyway,
But yeah, when we first met,
Mhm.
I think it's safe to say you were in a different place. I think you can speak to
Yeah.
that more than I can.
Yeah.
And I remember we were pretty early dating on that you were very honest with me. You called me one day and said there's something I need to tell you. And you wanted to tell me that you had an eating disorder. And you had done such an incredible job of explaining it. And I really encourage you that I know that you spoke to somebody to help you get the language that you felt needed. I guess it was a therapist at the yeah.
I talked to my therapist, Christy. Shout out to Christy. Yeah.
And you just did a great job, and I think it gave me such a great foundation. And again, I didn't really know what I was doing or how
He
to,
surely didn't. No.
but I think you did such a good job of explaining it, and you were welcome to ask any you welcomed me to ask any questions, and you kind of gave me this safe space in this moment over this phone call to talk about it and ask questions to sort of set me up for success so that you could set us up for success. And I think that was really I think a bigger deal in a good way than I think you maybe even realized.
Yeah. So I think at that point in recovery, I definitely was trying to recover. So like I wanted to be open and honest with the person that I was dating of like, hey, this is what you're in for. If you're not here for it, like it's okay. Also, like let's have an open conversation about what it can look like. Not saying it will or won't look like
Yeah.
this. So we would say starting out, if you're in like the dating phase and you feel safe and comfortable with the person you're dating with, Andrew did a really good job of helping me feel that way. Hence, we ended up together. Um, I would say if you can find the words and find the strength, share with your potential partner or, your boyfriend, girlfriend, whoever, about your disorder,
Mm.
if that feels safe and comfortable for you. Would
Yeah.
you agree with that?
Oh, I 100% agree. And I think that it was really cool that in that moment you were like, if you have any questions, let's talk about it now.
Yeah.
And then I did because I think it would have been harder like if he would have just told me and then there wasn't a dialogue, which I mean that's a hard thing to do and you did a great job. And then like it was left me wondering or I didn't feel like I had to walk on eggshells at all because I
Yeah.
had a really yeah, because you
We
were
could
very
talk about it.
yeah, and we had that time to really dialogue about it.
Yeah, for sure. And in fairness, I kind of had a leg up,
Hmm.
right? Being a therapist, I was already in the field at that point. I was treating eating disorders at that point, but I was still in the mess of my own mess
Hmm.
and trying to figure it out. So if you're struggling to find that language, if you are the person who's struggling, it's okay. Also, if you're like, hell no, I am not telling anyone about this, also fine. I would encourage you to maybe talk with a therapist or like a trusted person to find the language when and if you're ready. Because I think having the language around your disorder can help who's ever supporting you support you best. Because like as much as I would love even in just marriage, Andrew, to read my mind, none of us can read each other's
I'm
mind.
working on it.
He's
I
working.
mean, I do have a question for you. Like,
Yeah.
what made you feel comfortable originally even having that conversation with me? Because I think that, like,
That's a good question.
yeah, I don't know. I've never asked you that.
Yeah. Well, I think at the beginning of our relationship, right? Like we were in like the honeymoon phase of things. So like we both were minding our P's and Q's and just being our very, very best selves because that's kind of how relationships start, right? And then life happens and it can get messy.
Yeah.
But I think you from the moment we met made me feel very comfortable. So I think if you are with someone and you have the luxury of feeling again safe and comfortable with them, I would encourage you to try and have a conversation like this, just kind of sharing whatever again feels safe for you about your disorder with your partner, because they're going to ideally be the person closest to you or very close to you as you navigate your journey of recovery. So I think too, like I didn't want to be in my disorder at that point. And no one ever really wants it, but like I was sick of it. So like I was like, oh, I am thinking of pursuing this person, more long term and things like that. And we were boyfriend and girlfriend. That feels so funny to say, but we were at
Yeah.
that point. So like it kind of felt like if this person and I are going to continue down this path of like being committed to just each other, I felt like, and this is not everyone's feelings, but I felt like he deserved kind of that information.
Yeah.
Yeah.
Sir.
Does that make sense?
Yeah.
Yeah. Yeah. And then, okay, so we shared a little bit about our story, and how it started, but as many of you know, eating disorders aren't just gone like that. So I didn't have this conversation with him. He didn't just swoop in and then everything was fine. I wish, I'm sure you wish too, that it would have been that simple, but we had a journey, right? Like I had a journey. I had a lot of recovering to
And I
still
think there were ebbs and flows to it. Like
for sure,
yeah, like
for sure.
so I think that as we got deeper into our relationship, life was happening more. I mean, I think you had a new job or something.
Yes.
And I definitely felt like there was some added stress. And then I think that's when I started to see the eating disorder more. And you had let me into it in a
Yeah.
different way. So yeah, I definitely like when we first talked, I don't think I had any clue.
Oh,
And or I mean I don't
maybe, I don't know.
but I really as we got closer and as like you said,
Life happened,
yeah.
things, our relationship deepened, things like
Yeah,
that.
so that was definitely you A let me in, but B I also could really
You
I
could
could see
see
it.
it.
Yeah,
Yeah. We were also like around each other all the time.
Mhm.
So yeah. And I think once I let you in, for me, I didn't feel the need to hide it at that point. Like, and again, I was really in a place where I wanted to get well, but I was struggling to choose recovery line behaviors. So yeah, so tell everyone a little bit about what was helpful to you as I was kind of like in the thick of it for a little
Yeah.
bit while we were
And I think you had kind of just said
early
it,
on.
you had said it a minute ago. I think that like realizing that you didn't want this
Right.
eating disorder,
That
that
did
it
not.
was something that like, and I think sometimes, a naive person would be like, well, then just eat. And like, but that's not how that works.
Yeah.
And we know that.
Yeah.
But I think that like it was something that was like it was an active struggle. And it was something that like you were fighting against. Like I almost saw like a battle
Yeah.
internally in you.
That is what it's like. I'm
And
sure people can relate to
and
that.
once acknowledging that like the eating disorder is I mean I always saw it as like the enemy of my girlfriend at the time. I don't know, but that's just that like and it wasn't, although it's a part of you, it's not you. So when you were refusing
Engaging in
yeah,
symptoms. Yeah.
yeah,
Mhm.
that wasn't it wasn't even a choice. And I think that like the sooner
Yeah.
I
Right.
realized that, the sooner because then I wasn't getting frustrated with you. I was more like,
Right.
how can I help? Because I think it would have been really easy for me to be like, well, why is she being this difficult? But that's
Yeah.
not what that was.
Right.
So I think that was a big thing was that realizing that like you are not your eating disorder,
Right.
it's
Right.
a, and then two, realizing that, patience is the most important thing.
Yeah.
Um, realizing that it was a journey and that the only way that I was going to continue, you could have blocked me out if I would have ever been too forceful or
Right.
too, in your face about it. So I had to be patient and I had
So
to be
no food
gentle.
policing. We don't
Yeah,
need you to, we need encouragement, we need kindness, we need
exactly.
support, we need suggestions, which we'll get into in a minute. But Andrew was not the food police. There were times that I think maybe I felt that way, but he was definitely really good about just being like, what if we try? Right? Like it was
Yeah.
never like sit down and eat, which although I understand that that might feel like what you want to do for your loved one because you're like, oh, please eat. And just like he said, this was never my
Yeah.
choice. It was not a
And I
choice.
think
It is not a choice.
I learned pretty quickly that like I needed to have a lot of my own resources at my disposal. So like
Mhm.
if we were and we would have like phone conversations a lot and be like and we would sort of talk about like what you ate today.
Yeah.
And that was sort of the process and I knew that in my mind pretty quickly I had to have a list of 10 to 12 things that I knew you really liked that I could just reference as if I was just saying it off the cuff, but like no, I had them in my brain
Yeah.
so that one of them might have sounded okay when I knew that like, oh, this, dangerous. You didn't, you may have not had
Had enough that
had enough
day.
to you had enough that day. Like, well, okay, here are three or four things that I know that she has readily available, or things that like I could go get her, or if she was okay with it. And so having that kind of in my arsenal of
So check-ins and
yeah,
suggestions.
but also like
Mhm.
knowing your partner.
Knowing,
Like that was,
yeah,
you know, my wife is kind of a picky eater.
I am still kind of picky.
Yeah,
Yeah.
and I mean she likes you like what you
I like
like.
what I like.
Yeah.
Yeah.
So like knowing like I think I was joking with you that like when I first met you, like chicken parm was your top food group. You
Yeah.
love
I
chicken
think it's
parm
still up there,
because you're Italian. And so knowing and
even
knowing,
in my disorder.
yeah.
Yeah.
So I knew that about once every 3 weeks I could
Mhm.
get you to have chicken parm.
Okay.
So I knew I had to keep it like when was the last time we went out and had chicken parm? And that was like a thing of just knowing that like that was something that was doable. So I had like that. Those are the resources I'm talking about. Just
Yeah.
knowing what felt okay to
Safe.
you. Yeah,
Yeah.
safe.
Safe
Yeah,
foods.
yeah.
Yeah.
And
Yeah.
then also knowing like, well, when was the last time? Because I know that that was all stuff you calculated in your brain
Yeah.
constantly,
Mhm.
knowing that I had to do some of that too to make sure that I was setting you up for success as best I could, or setting us up for
Yeah.
success. Yeah.
Yeah. So, okay. So showing up patiently,
Mhm.
kindly, with resources, and resources can be a multitude of
Yeah.
different things, whether it was Andrew was really good. He would do a lot of check-ins on me. And it wasn't, again, it was never like he was policing me. It was just like, hey, what'd you eat today? Right. Like just a really simple question that wasn't loaded. It wasn't followed up with anger or frustration. And I will say what was different for me was that I have had people in my life in the past do check-ins, but when they got an answer that didn't align with recovery, not because I didn't want to align with
Mm,
recovery, but because I was struggling, I was met with frustration and anger.
yeah.
And it's okay. If you are the support person and you're frustrated and you're angry, your feelings are 1,000% valid. And if you take them out on your partner, that's not going to help during this time. So I would encourage you to like hold space for those emotions. They're real, they're valid, they have so much sense. And in those moments, especially moments around food and body image and things like that, they just need to be put on
Yes.
pause, right? There's something you can talk about later. There's something maybe you can talk about with an outside party.
Mm,
But in those really heavy moments, if you meet someone with love and compassion, they're much more able to let their guard down. Where if you meet them with frustration, again, which may be valid, it's really hard, especially speaking from someone with this experience, to then engage in those recovery type behaviors.
yeah.
Okay, so that was kind of when we were in the thick of it, right? And I will say, Andrew, again, really just continued to show up, continuing to show up, go so far. And again, with kindness and very little expectation on his part. Like it was kind of like he knew what I needed to do, and he was going to continue to gently push or gently suggest, but he wasn't going to bulldoze because I think he knew it, again, it wasn't me not wanting to engage in those suggestions. It was my disorder.
Yeah.
Um, so if someone is watching this and they are a loved one, a partner, what are some tips you can give them? We've already said checking in,
Mm.
being patient, meeting with love and compassion. What else could they do?
I think, and we kind of touched on it, but I don't think I can stress it enough that like, you know, Gabby was not her eating disorder, and
Yeah.
s-
And I am not my
and
eating
yeah,
disorder.
and because
Yeah.
like when you were saying like it doesn't help to be mad at you, like there were times I was really frustrated with your eating disorder, but if when I realized that that's not you, like the anger, I wasn't capable of being angry at you because I saw that it was
It was
something
something
else.
separate.
So like
Yeah.
when you come to that understanding, I really think that like just how you respond naturally, your natural inclination to respond with frustration, it would change, and it changed for me because I think I don't think I understood that right away. I think I
Mhm.
learned pretty quickly, but I remember our dialogue before and after that, and it was, I don't want to say easier, but simpler.
Mhm.
Um, when I realized that it was that it was almost like a separate voice in your head, kind of wreaking havoc in your brain,
Yeah.
and that. So I think that to me is a big one. Is just having an understanding of it, because then all of the things that we've talked about just get a little bit simpler.
Yeah. And this is something I try to say a lot to support people when I get the privilege to talk to them, is that like, remember that your loved one who is struggling, this is not something that comes up once in a while. This is all day. We have to eat to survive, or we have to take care of our bodies in a way, that will help us to continue to live a long life. And meals are part of that. And so like we're dealing with this every single day, sometimes at every single meal. Not always, right? And everyone's relationship with food and their disorder presents differently, but acknowledging that that voice is really loud and pretty constant. I think too, one thing that you did well was like, yes, you would compliment me physically, but when it came to a point where I was able to say to you, like, thank you for saying that, but I need you to compliment me for different things, you really did a good job of taking the focus off my body. So I would, although I know that Andrew thinks all good things towards my body, he does a really good job of saying, for example, the season we're in now, he'll say a lot like, you're a great mom.
Mhm.
And back then he would be like, you're a good therapist. You're a great friend. I love what a good friend you are. He did a really good job, or like, thank you for being my girlfriend, or just things that were
Mhm.
not focused on my body, but still affirmed to me that he loved me
Yeah.
and that he was interested in me outside of my appearance. So I think that's something I think naturally you probably thought, let me tell her how beautiful she is regardless,
Yeah.
right? Which I think is really common. And that's not to say that's bad. And I'm not here to tell you how to talk to your partner. But I would say if they are in the midst of recovery, and I'm going to assume body image may be a piece of this, I would recommend trying to take your compliments outside of their physical appearance and work more towards their identity, because that's work they're going to need to do
Mhm.
anyway.
Yeah.
What do you think?
No, I want, yeah, 100% agree. And that was weird for me because I think
Sure.
as a man and a man that's, it's really easy to be like, oh, you're so beautiful, and I mean that, and
Thank
so I think that like, yeah, that definitely there was a lot of sorry, there was a lot of conscious thought that had to get into that because that
Yeah,
was unlike anything I'd really ever experienced before. But I saw that it was worth it. Yeah.
yeah, yeah.
Mhm.
So as my support person at the time, that was probably really heavy. It was probably a new experience for you,
Yeah.
right? And it's not like Andrew was just with me through this very briefly. This did go on for a fair amount of time, but then it, thank goodness,
Yeah.
it did get better and I was able to heal and all those things, and now we're here. But how did you support you? How did you take care of you? Because that's really important.
I think that the further we got into the relationship, and I think it kind of how I worked with you helped me.
Mm,
I think as we began to develop a relationship, there were times when you would really just try to push me away, and
sure.
sometimes
Yeah,
you were a little mean, and
I'm sure.
and when I realized not to take that personally and being able to separate it, but also to kind of just to continue to like build up our trust, it got so much easier. So there was times when I would be like, "Hey, why don't you just eat this?" And then you'd be like, "Okay." But if I would have asked that a month prior, you would have like it would have
Oh, no.
yeah, and
Yeah.
you not that you would have I don't think you would have gotten mad, but you would have just shut me down really quick and the
Mm,
conversation would have ended. So I think that like I realized it was really important to continue to work on us as just us.
mhm.
Because I knew that the closer we got, the more that we would be able to trust each other and lean on each other just in life and not just
Yeah,
in this eating disorder thing. And realizing that like although the eating disorder felt really big and it sometimes felt
overwhelming, I'm
overwhelming and that
sure.
like it,
Yeah,
but I tried to never let it over, and I think we both did
yeah,
encompass the relationship.
yeah,
It wasn't the relationship. Oh, we were
totally,
the relationship.
totally.
I think that too, and then, I had a good therapist at that time
Yeah,
too that just we didn't talk about it a ton, but I think it was more we spoke more about how to continue to love someone through
anything
anything. Yeah,
difficult. Yeah,
there really wasn't much talk about I never went to this person to ask advice on what eating disorders were or anything like that. It
yeah,
was more of just in any relationship, you really need to get better at communication and get better at loving on each other and working through stuff with each other, problem solving.
yeah,
Like so just like continuing to work on building a relationship and not letting the eating disorder sort of derail it because I
yeah,
think there are many times when that could have happened.
totally. I agree.
And there were many times early on where I think you really did. Like I said, you tried to push me away and I was too stubborn for that. So um
You
y-
loved too much.
yeah, and realizing that like this was worth it and being able to yeah, love you through it in the way that any couple would need to love each other through anything.
Any hard time.
Yeah, so
Yeah,
I think that like that was really important, like continuing to work on stuff other than just the eating disorder recovery part
right.
of our
It didn't
relationship.
consume our really
Yeah.
totally.
Yeah.
I totally agree with that. Yeah. Because it already, I think I felt like if we would have gone down that road, I'm really glad we didn't.
Mhm.
I was already consumed enough by it.
Yeah.
And I'm sure anyone listening, if you are in the throes of an eating disorder, you can relate to that. But I think, yeah, we both, I think, did a good job of still having a relationship while I tried to work through recovery. And I think you said you had a therapist. So if you have the privilege, we acknowledge that therapy is a privilege.
Yes.
If you have the privilege of talking to a therapist or a trusted person about this issue, I would definitely recommend that, because how I was saying about the frustration, those feelings are, again, so valid.
Yeah.
But a great place to process them is in therapy, or a great place to process them is with like a safe friend.
Yeah.
I think you also continued, so Andrew's a musician. He continued, like, just like we said, we continued to have our relationship apart from that while healing in it. Andrew did a good job of like doing the things he loves still. Like he didn't let this consume him either, which I think sometimes as partners, it's okay. You're scared.
Yeah.
That can happen, but I think continue to take care of you with the things that you love and the people you love, and just as much normalcy as there can be
Yeah.
to take care of yourself, I think is important.
And I think it was also important to remember that it wasn't my eating disorder, it was
Right.
yours.
Yeah.
And
That's such a good way to
I'm
say it.
there to be your support person, but it's not.
You don't need to fix it.
Yeah, yeah, but again, I don't think that that's just specific to eating disorders. That's any
Totally.
sort of mental health thing. Is when you're in a relationship as the partner, it's not my job to fix it. It's my job to be there
To show up.
and yeah, and that's
Yeah.
all I really did.
Yeah. Well, you did a really good job. Also, one thing that you did do that I don't want to forget to share, and I know we're not on the tip question anymore, but Andrew did a really good job of embracing health at every size. So this guy will walk around and yell food freedom and will basically be the opposite of the
Food
food
is
police.
neutral. That's
Yes,
what
food is
we're trying to say,
neutral. He
yeah.
loves to say that, and he's right.
And but I really, you opened my eyes
Yeah.
to the diet culture, and that like even in like in places of just like that I do find myself that again I still don't I still have a lot of work on that.
Work in
Yeah,
progress.
but yeah, I definitely you have opened my eyes to that, and I enjoy being like when someone's like, "Well, that's unhealthy." I'm like, excuse me, but food is neutral.
Food is neutral.
I
Yes,
do,
food is
and
neutral.
I love saying that, and it confuses people, and sometimes I don't even explain it. I just say it, and that's
Yeah.
even funnier because it's not worth it. But yeah, no, I definitely there was an education process that I
Yeah.
needed to go through that was just beneficial to learn in general. You know, I didn't.
Yeah.
It would have been beneficial for me to learn not just because you were going through something, but because, I needed to open my eyes just because I never really had to deal with it before.
Yeah. But so I think if your partner is struggling, if you have the brain space, the bandwidth to take some time to just learn about health at every size and body neutrality and things like that, I think that can go a long way, because know that like that for me was really powerful and healing. Now, not everyone will align with that. And if you don't align with that, that is okay. Again, whatever recovery looks like for you, we are here to support that. But I think you did a really good job of, like taking the time to just nothing deep, like read a couple articles that I sent you, and then just us having, again, open conversation. I think the more we can open the lines and keep the lines of communication open, that's so key, because I know when I was in my eating disorder, isolation is what it loves to do, and that's really where it can grow. So I think the more you can communicate with your partner and the more your partner is receptive to that information, the better.
I think that was the thing, and forceful is not the right word, but that was the thing I was most uh when you would try to be like, I don't want to hang out, I want to see you. I would like that would be the thing that I would try to push to change your mind the most, because I understood that like although you are an introvert, you do like being around people.
The people I like.
Well, and
Like him.
yeah, so I think that was like that was almost one thing that was just sometimes it was just more important to convince you to let me come over or to hang out, like, and again, all the other stuff was just extra. So I definitely did see, I had kind of forgotten about that you really did isolate. And I think one of my big things is I really tried to not let you, because I knew that that was only going to make it worse.
Yeah. Yeah. I totally remember that. And yeah, you were not forceful. You were honestly adorable, and you would do it just right. But I would say, yeah, if your partner is isolating, respect their space and maybe try to see if there's a way that you can see them or take them somewhere they really love or something, just to get them out of that space, because that is where their eating
And-
disorder can grow.
And I think remind, like, we used to talk on the phone a lot. Like
Yeah, we did.
So I think that like there were times when you didn't feel maybe like you wanted to see me, but you were okay to talk to me. So like
Yeah.
we would like almost every morning on our way to work,
Oh
we
my
would talk
gosh,
on the
that was the
phone.
worst.
Yeah.
Not the talking on the phone, but that drama.
Yeah, yeah. So I think that just like
Ugh, the
getting
jobs we were
getting
in.
creative, that like isolation isn't necessarily just like a physical thing. Like it
Yeah,
is a,
yeah,
and I think
that's such a good point.
we're in 2024 with the post-pandemic. We understand that better than ever.
Totally.
But just
This was
know that
2017.
that communication is so important.
Yeah,
Yeah. So,
yeah, absolutely, absolutely. So if you are a support person who's feeling stuck, let me just kind of recap and jump in if I forget things, babe. So we're going to, again, patience, love, compassion, educate ourselves, kindly check in, try not to let our partners isolate if we can, and keep the lines of communication open, and make sure that you are taking care of you. One thing we offer at Recovered and Restored is support for partners. So if you want to talk to Andrew, I can make that happen. He's not officially on staff, but he's a really great support person.
unpaid tech intern. That's what I am.
Or we have a family services director. Her name is Beck Leatherman. She is just wonderful at speaking with partners and kind of meeting people where they're at in their relationships, or even doing some couples therapy if that's necessary for you or helpful to your relationship. Also, any one of our individual therapists would be happy to speak with you or your partner. If you are the one who is struggling, we are accepting clients. We would be honored to share in your journey. I want to remind you guys that this is not therapy. This is not a supplement for therapy, but we hope that you found this helpful today. And if you want to find us, you can find us at recoveredandrestoredtherapy.com. Also me on Instagram at Gabrielle LPC and at Recovered and Restored. Also, what's your Instagram?
It's AMBI731.
Let's go with that.
Yeah.
At AMBI731.
Yeah.
You can message Andrew. He'd be happy to chat with you. Again, not therapeutic advice, but just friend to friend, peer to peer. It's a really hard spot to be in. And we have a YouTube page as you're watching, so please subscribe. But yeah, thanks for being here, babe.
Thanks for having me.
Yeah, this was great. Awesome. Thanks, everyone. I hope you have a great day, and we'll be back soon. Bye.